Okay, so welcome back to another episode of the Men's Hub. So whilst some of our conditions have been relatively trivial, some of them might be psychological or emotional, some of them might be about masculinity, today's is perhaps a little bit more sinister and serious. Today we're going to be talking about understanding and supporting prostate cancer. This is a type of cancer that develops in the prostate gland. It's a small organ located below the bladder in men, and it's one of the most common cancers in men, especially those over the age of 50. Early detection and early treatment can significantly improve outcomes. This is not one to sit on, and it's why we encourage people to go and get their prostate checked. So the risk factors for this are, generally speaking, men over 50. You may have had a close relative with prostate cancer, and that can increase your risk. It is more common in African American men. Usually if you have a diet that is high in red meat, processed foods, or a low take of vegetables, you're more at risk. If you have a sedentary lifestyle or obese, then you're more at risk of prostate cancer. And if you have experience of hormonal imbalances, so higher levels of hormones such as testosterone in your system, that would be noticed with people who have lost their hair early. So premature baldness might be indicative of someone who's more at risk of prostate cancer. Now, common symptoms. You're generally going to need to urinate more often, and especially at night. So these are people who just have a frequent urge to go to the toilet. And yet, despite the urge, the urine flow can be interrupted or it can be weak. There can be difficulty starting and stopping urination, so having the control kind of to get going and then also dribbling at the very end of urination. There can be pain and burning whenever you go to the toilet. There could be blood or urine and semen in the urine, which would be like a white flow or texture at the start or the end of the urine. There can be pain in the lower back, hips or pelvis. And there can also be erectile dysfunction where you're just not able to get it up. Early stage prostate cancer may not be noticeable at all, which is why screenings are important. Not everybody's going to like the experience of having your prostate examined, but it is one that is worth getting done. There's a digital rectal exam, this is the DRE, and a doctor will feel the prostate for abnormalities. A biopsy, which confirms the presence of cancer cells, is often asked for. There's also some other tests that are done. So this is the PSA test, which measures the prostate-specific antigen levels within the blood, and elevated levels can indicate prostate issues. And then you can have imaging done. This is an MRI or CT scan, which can be used to determine the extent of the cancer and for it to be graded. Now, there's a lot to be said for natural and lifestyle approach for prostate cancer. I have a separate information on the Cancer Hub, and I would recommend anybody that gets a diagnosis for prostate cancer to use the Cancer Hub rather than just this one handout on its own. But when it comes to nutritional, natural and lifestyle support, there's a few things that you can really focus on. So lycopene-rich foods such as tomatoes, watermelon, pink grapefruits have really strong antioxidant properties that can reduce cancer risk. Cruciferous vegetables, so these are things like broccoli, cauliflower, Brussels sprouts and kale, contain compounds that support detoxification and they can inhibit cancer growth. Omega-3 fatty acids are found in fatty fish, flax seeds, walnuts, and they help reduce inflammation. Green tea contains catechins with anti-cancer properties. Turmeric and its constituent curcumin is a powerful anti-inflammatory and antioxidant that may inhibit cancer growth. And avoid processed or red meats. So limit the intake and reduce the inflammation and the carcinogen exposure. When it comes to herbal applications, saw palmetto is a go-to for many herbalists. It supports overall prostate health and it may ease urinary symptoms. Pomegranate extract is rich in antioxidants and it can slow cancer progression. Milk thistle supports liver detoxification and reduces oxidative stress. And then ginger is anti-inflammatory and it can reduce the tumour growth. There's also quite strong chemo based herbs that you can use. I would tend to use things such as thuya, catharanthus, and I can use them in different ways. We can use them as a suppository, and we can use them internally. And I would also use things such as mushrooms whenever people are going through radiotherapy or chemotherapy. Now, when it comes to stress management, chronic stress can really negatively impact the immune system and cancer outcomes. Practices such as meditation, deep breathing can all help balance out stress, and you should consider counselling or support groups to manage the emotional roller coaster that you're currently on. Regular physical activity will improve circulation. It also reduces inflammation and it supports the immune function. Moderate, intense activities such as walking and swimming are all beneficial here. Obesity can lead to worse outcomes, and part of that is because estrogen sits in the fat cells. So whenever you reduce the fat cells, you're getting a higher dose of estrogen. Estrogen and testosterone are very similar, but this is pro-cancerous. So a balanced diet and regular exercise are really helpful. Now, when it comes to medical options, there will be an option to survey, monitor any low-risk cancer changes. You might be offered surgery for the removal of the prostate gland. That can lead to consequences such as erectile dysfunction, and some people can end up needing to be bagged rather than able to urinate normally. Radiation therapy, and again, similar side effects to this, but a targeted treatment to destroy the cancer cells is possible. Hormone therapy, which can reduce the amount of testosterone in your system, can help slow cancer growth, and then chemotherapy is sometimes offered for aggressive cancer. Now, the complementary support. Acupuncture, interestingly, can help manage pain and any side effects of treatments. Some mind-body therapies like Tai Chi, Qigong help improve physical and emotional well-being, and there's some evidence to suggest that probiotics in your gut can actually help during cancer treatments. Now, when do you seek medical advice? Well, if you have any difficulty urinating or persistent pain in the pelvic area, if you find any blood, urine or semen, any unexplained weight loss or fatigue, any family history of prostate or other cancers, then this is one to seek further advice. It's a cancer that's manageable, especially if it's detected early. This is one you want to get seen and have checked relatively regularly. You want to consider a healthy diet, nutritionally dense diet, regular exercise and stress management to support your overall health and well-being. There is loads to do with herbs and medicine that can really support. This is just a sample of a daily routine for prostate cancer support. In the morning, start with a smoothie containing spinach, berries, flaxseed and a pinch of turmeric. Enjoy some salad with broccoli, tomatoes, dressing, olive oil and lemon at midday, and perhaps a 20 or 30 minute walk to boost circulation and mood. In the evening, consider some fatty fish, salmon, some Brussels sprouts, and practice some mindfulness to help with meditation and stress relief in the evening. There's a lot more information on prostate cancer and indeed all cancers on the Cancer Hub, and you can avail of that at your leisure. This is just an introduction to let you know what's possible. All right, thank you.